Hello everyone, welcome back to the channel. If you're new here, welcome. Today we're discussing an important topic, the use of cannabis for seniors, especially when it comes to neurological conditions like Parkinson's disease. Before we get started, please note that Miriam's Hemp does not give or substitute for medical advice. Miriam's Hemp specifically invokes the First Amendment rights of freedom of speech and of the press without prejudice. Any statements made in this video have not been evaluated by the Food and Drug Administration. Any products discussed are not intended to diagnose, cure, prevent, or treat any disease. Miriam's Hemp always recommends when and wherever possible that licensed local healthcare professionals be consulted. With that said, let's take a closer look at why so many seniors are turning to cannabis, not just as a last resort, but as a proactive choice in managing neurological health and improving overall quality of life. What is Parkinson's disease? Parkinson's disease is a progressive neurodegenerative disorder that primarily affects movement. It belongs to a group of conditions called motor system disorders. The four hallmark symptoms include tremors in the hands, arms, legs, jaw, and face, muscle stiffness, and impaired balance and coordination. As the condition progresses, these motor symptoms can make everyday tasks like walking, talking, or getting dressed increasingly difficult. But Parkinson's disease isn't just a movement disorder. It often comes with a wide range of non-motor symptoms too, including chronic pain, sleep disturbances, anxiety, and fatigue. These symptoms can be just as debilitating and can deeply impact a person's daily quality of life. What causes these changes in a person? While Parkinson's can affect anyone, age remains the most significant risk factor. Most people are diagnosed around age 60, but about 5 to 10% experience early onset Parkinson's, which can begin before the age of 30. In those cases, genetics often play a bigger role, with some early onset forms linked to specific gene mutations. Other than age, one key factor is the loss of dopamine-producing neurons in an area of the brain called the substantia nigra. Dopamine is a chemical messenger that helps regulate movement, mood, and coordination. In Parkinson's, as more of these neurons die off, dopamine levels drop, leading to the movement and mood-related symptoms we associate with the disease. Protecting these dopamine neurons is a major goal in treatment research, and it's one reason why scientists are taking a closer look at cannabis and its potential neuroprotective effects. Managing Parkinson's can feel overwhelming, but there is a growing body of research suggesting that cannabis may help ease some of the burden by targeting both motor and non-motor symptoms. Neuroprotection and disease progression. Let's first look at how cannabis may help slow the progression of Parkinson's. Cannabinoids, particularly CBD and THC, have shown promising neuroprotective effects. In one study published in the British Journal of Pharmacology, researchers found that activating the body's endocannabinoid system may help protect brain cells and improve motor function, which is crucial for those affected by movement disorders like Parkinson's. Cannabis has also been shown to help reduce brain inflammation. Chronic brain inflammation is linked to neurodegenerative diseases like Parkinson's. Cannabinoids like THC and CBD can help calm the immune response, which may slow disease progression. A study published in the Journal of Neuroimmune Pharmacology supports this by showing how cannabis could regulate brain inflammation. Parkinson's disease disrupts the brain's ability to produce and regulate dopamine, a chemical messenger critical for movement, coordination, and mood. As the disease progresses, dopamine-producing neurons in a region called the substantia nigra gradually die off. Dopamine allows nerve cells to communicate, enabling smooth and controlled movement. But by the time motor symptoms like tremor, stiffness, or slowness appears, up to 60 to 80% of these neurons may already be gone. Protecting these dopamine neurons is a major focus in Parkinson's research. That's where cannabinoids show real promise. By reducing inflammation and oxidative stress, certain cannabis compounds may help protect these critical neurons and support the brain's ability to function more smoothly for longer. One study combining CBD, THC, and natural compounds like resveratrol found strong potential for protecting dopamine-producing neurons from oxidative stress, a type of cellular damage caused by free radicals that contributes to the progression of Parkinson's. Resveratrol, a natural antioxidant found in red grapes and berries, is known for its neuroprotective properties. Together with cannabinoids, it may help shield vulnerable brain cells and support long-term brain health. Incorporating certain terpenes can also be beneficial. Beta-caryophyllene, a terpene found in black pepper and some cannabis strains, has anti-inflammatory and neuroprotective properties by activating the CB2 endocannabinoid receptor. For Miriam's hemp offerings, adding additional beta-caryophyllene to tinctures could provide more relief for seniors managing neurological conditions. Pain and stiffness relief. Now let's talk about pain and stiffness, one of the most common and debilitating symptoms of Parkinson's disease. Muscle rigidity and joint pain can make even basic movements exhausting. Dystonia, a condition that can occur in Parkinson's patients, causes painful muscle contractions in areas like the feet, hands, or neck. This results from disruptions in the way the brain signals muscles, and it contributes to chronic pain and stiffness. Cannabis can help in a number of ways. CBD and THC work together to reduce inflammation, relax muscle tension, and modulate nerve signaling. This can provide relief for both physical and neurological pain. The National Academies of Sciences, Engineering, and Medicine released a comprehensive report in 2017 confirming that cannabis is effective in treating chronic pain, especially nerve-related pain, and could be a safer alternative to opioids for older adults. Relief of non-motor symptoms. Parkinson's disease isn't just about tremors and stiffness. It also includes sleep issues, anxiety, and mood. A 2024 case series in Frontiers in Human Neuroscience reported that short-term use of low-dose THC to CBD cannabis extracts significantly improved insomnia and cognitive discomfort. Sleep-related issues are another big concern for seniors with Parkinson's disease. The study also found that CBD improved REM sleep. CBN is also known for its sedative effects that may also work in the same way as well. For seniors with Parkinson's who struggle with disrupted sleep, CBN may be a helpful addition to their nighttime routine, especially when paired with calming terpenes like linalool or myrcene. And according to a national survey published by the NPJ Parkinson's Disease, patients most commonly use cannabis to manage non-motor symptoms like anxiety and sleep disturbances. The same study found that nearly 25% of those users stopped within 6 months due to lack of effect, underscoring the need for proper dosing and product guidance. Long-term safety. Naturally, safety is a top concern. A 2023 retrospective case control study published in Parkinson's and Related Disorders tracked Parkinson's disease patients using medical cannabis over 1 to 3 years and found no significant cognitive or neuropsychiatric side effects. In fact, mood and cognition remained stable, suggesting that cannabis can be a safe, long-term option for some patients. For seniors and caregivers navigating life with Parkinson's, there is genuine reason for hope. Studies and patient reports suggest that cannabis may ease some of the hardest symptoms, helping to dull chronic aches, promote more restful sleep, and even reduce muscle stiffness and rigidity, and even tremors. It's not a miracle cure, but even these small comforts can make a big difference in daily life. You are your own best advocate. If you or a loved one are curious about cannabis, bring up the subject with your doctor and share what you've learned. If this video gave you hope or helpful information, please like, subscribe, and share it with someone who might benefit. Until next time, stay informed and take care.